Did you know that despite their popularity and numerous health benefits, dates are not suitable for everyone? That's right. There are certain health conditions where you'll have to think twice before indulging in these sweets. In this video, we'll talk about the common side effects of dates and why you should avoid them if you have certain health problems or are taking certain medications. By the end of this video, you'll have a clear understanding of when you should eat dates, how to consume them sensibly to reap their health benefits, and when it's best to choose alternative snacks. We will also cover what the science says about when it is best to eat dates and how to consume them to minimize the various side effects for those who experience them. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. First, let's break down what health conditions dates should be avoided for. Number 1. Diabetes and blood sugar problems. While dates have various nutritional benefits, they also contain high amounts of natural sugars that can cause a spike in blood sugar levels if consumed in excess. Therefore, if you suffer from diabetes or are trying to control your blood sugar levels, you should be careful when consuming dates. According to the U.S. Department of Agriculture, one date, especially the medjool variety, contains about 18 grams of carbohydrates, of which 16 grams are sugar. For comparison, that's almost as much sugar as is contained in 4 regular Oreo cookies. So eating a few dates in one sitting can quickly lead to significant fluctuations in blood sugar levels. In addition to their high sugar content, dates are also relatively caloric. One date contains approximately 66 calories, which may not seem like a huge amount, but eating a few dates can quickly lead to a calorie surplus, which will eventually lead to weight gain. So if you are also trying to maintain a healthy weight, be careful. For people with diabetes, these blood sugar spikes can be especially dangerous. When blood sugar levels rise too quickly, the body doesn't have time to produce enough insulin to regulate it effectively. Over time, persistently high blood sugar levels can lead to serious complications such as nerve damage, kidney problems, and an increased risk of heart disease. So what should you do if you have diabetes but want to enjoy the sweet flavor and nutritional benefits of dates? The key is moderation and careful monitoring of blood sugar levels. Since 2 dates are the usual recommended daily allowance for people without diabetes, if you have diabetes, you can reduce them to 1 or give them up completely if they cause blood sugar spikes every time. If you are unsure, consult with your doctor or a registered dietitian specializing in diabetes care to determine how many dates, if any, can be safely incorporated into your individualized meal plan based on your specific blood sugar goals and medication regimen. Number 2. Digestive issues. When it comes to dates, another important consideration is their carbohydrate content. Dates are among the foods that are high in FODMAPs, meaning they contain special types of carbohydrates that are poorly digested in the small intestine, leading to digestive upset in some people. FODMAPs, which stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are short-chain carbohydrates that can be fermented in the large intestine. Dates contain 2 types of FODMAPs: fructose, a monosaccharide, and sorbitol, a polyol. When these FODMAPs enter the large intestine undigested, they can draw water into the intestine and cause fermentation, leading to symptoms such as abdominal bloating, gas, abdominal pain, and diarrhea in sensitive people or people with irritable bowel syndrome, IBS. However, it is important to note that not all people with IBS or sensitivity to FODMAP will experience a negative reaction to dates. Tolerance levels can vary from person to person, and some people may enjoy small amounts of dates without experiencing significant digestive upset. If you suspect that dates may be the cause of your digestive problems, it's best to cut back on them or avoid them altogether. Later in the video, we'll look at a proven method, told by medical experts, for those who are sensitive to dates and don't experience digestive problems. Number 3. Cavities and dental problems. Although dates are often extolled for their nutritional benefits, their high sugar content and sticky texture can contribute to tooth decay and dental problems when consumed in excess or without proper oral hygiene. Dates are high in sugars including glucose, fructose, and sucrose. When you consume dates, the bacteria in your mouth feed on these sugars, producing acid as a byproduct. This acid erodes tooth enamel over time, leading to cavities and tooth decay. In addition, the sticky texture of dates allows them to stick to the teeth and gums, providing a prolonged source of sugar for bacteria in the mouth. This prolonged exposure to sugar can further increase your risk of developing cavities and other oral health problems. To minimize the chances of developing cavities when eating dates, it is important to practice good oral hygiene. After eating dates, Be sure to brush your teeth thoroughly and floss to remove any sticky residue between your teeth and along your gum line. If you can't brush your teeth right away, rinse your mouth with water to remove sugar particles and reduce the time they come in contact with your teeth. So if you have tooth decay or are particularly prone to it, it may be a good idea to limit your intake of dates and other foods high in sugar. Consult with your dentist to determine the best course of action to maintain optimal oral health based on your individual needs and risk factors. Number 4. Sulfite sensitivity. Dates, like many other dried fruits, typically contain high amounts of sulfites, compounds that are commonly used as preservatives to increase shelf life and prevent discoloration. While sulfites are generally safe for most people, some people may have an adverse reaction to these compounds, a condition known as sulfite sensitivity. Sulfite sensitivity is most common in people with asthma, with up to 10% of asthmatics experiencing sulfite-related symptoms. In these people, sulfites can increase wheezing and make breathing difficult. However, sensitivity to sulfates can also occur in people who do not suffer from asthma. So if you suffer from asthma or suspect you may be sensitive to sulfites, be careful when eating dates. If you're going to eat them, find ones that are labeled sulfite-free, because not all manufacturers use sulfites to preserve them. Number 5. People who are allergic to dates or pollen. Although allergies to dates are relatively rare, some people do experience allergic reactions after eating this sweet fruit. Allergic reactions occur when the immune system mistakenly identifies certain proteins in dates as harmful substances, triggering an immune response. Symptoms of a date allergy can range from mild to severe and include itching or tingling in the mouth, throat or lips, hives or skin rash, swelling of face, tongue or throat, difficulty breathing or wheezing, abdominal pain, nausea or vom, eating. In rare cases, anaphylaxis, a potentially life-threatening allergic reaction, may develop. In addition, some people with pollen allergies, especially to grass, ragweed, or tree pollens, may experience a phenomenon called oral allergy syndrome when eaten. Oral allergy syndrome occurs when proteins in certain raw fruits and vegetables, including dates, cross-react with pollen proteins, causing mild allergy symptoms such as itching or tingling in the mouth and throat. If you suspect you may be allergic to dates or experience any symptoms after eating them, you should see an allergist. He or she can perform skin tests or blood tests to determine if you are actually allergic to dates or if your symptoms may be related to other types of allergies, such as pollen. In case of a confirmed allergy to dates, it is best to avoid eating them. Also, read food labels carefully, as dates can be found in a wide variety of foods such as energy bars, baked goods, and snack mixes. Remember that although date allergies are uncommon, they can still have serious consequences for those who suffer from them. Number 6. People taking certain medications. While dates are generally safe for most people, they can interact with certain medications, especially those used to control blood sugar levels. As mentioned above, dates contain high amounts of natural sugars that can cause blood sugar levels to spike when consumed. For people taking medications such as insulin or oral hypoglycemic agents to control blood sugar levels, eating dates can interfere with the effectiveness of these medications. If you have diabetes and are taking medications to control blood sugar levels, eating dates in excess or without proper planning can lead to unexpected spikes in blood sugar levels. This can make it difficult to maintain stable blood glucose control and may require a change in the dosage or timing of your medication. Dates are also high in potassium, a mineral that plays an important role in heart function and muscle contraction. Although potassium is essential for general health, people taking certain medications, such as potassium-saving diuretics or ACE inhibitors, may need to monitor their potassium intake more closely. Consuming dates in large quantities along with these medications can lead to elevated levels of potassium in the blood, a condition known as hyperkalemia, which can negatively affect kidney and heart function. Therefore, if you are taking any medications, especially those related to regulating blood sugar or potassium levels, or suffer from kidney or heart disease, it is important to consult your doctor or pharmacist before including dates in your diet. So, what is the best time and how best to consume dates to maximize health benefits while minimizing or eliminating side effects? First of all, you need to consider the timing. There is no universal best time to consume dates. The best time may depend on your individual goals and health concerns. For those who are diabetic or have problems with blood sugar levels, it is generally recommended to consume dates as part of a balanced meal that includes fiber, protein, and healthy fats. This will help slow down the absorption of sugar and minimize blood sugar spikes. Such people should also avoid eating dates on an empty stomach or as a snack on their own, as this can lead to large fluctuations in blood sugar levels. However, if you do not have diabetes and are not at risk of developing it, eating 2 dates first thing in the morning is indeed recommended. For people with digestive issues such as IBS or FODMAP sensitivity, eating dates in small amounts and spreading them throughout the day is more appropriate and better tolerated than eating a large amount in one sitting. In addition, it is important to know how to consume them. Experts also recommend soaking dates overnight, 8 to 10 hours before consumption. This is because dates, being a true dried fruit, contain very little water. Soaking makes it easier to absorb the nutrients from them and also reduces digestive problems for those who experience them. If you forget to soak dates overnight, they can also be soaked for 10 or 20 minutes in warm water before consumption. If you'd like to learn about the many health benefits of dates, we have another video that goes into detail about it at the link in the description. How about you? Do you like dates? Have you experienced any strange symptoms after eating them? How often do you eat them? And what health benefits of dates have you noticed? Share with us in the comment section below. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.